I just had two people this week that came in with salivary tests that they could just order online off Amazon. And it was tough because I have to go through like, so sorry you spent that money, but we don't really find a lot of information that's credited. And we have many studies that show that food allergy testing, unfortunately, is not accurate. We want it to, but it just hasn't been shown to be accurate. But there are a few things I have just really kind of tried to tune in my years of doing dermatology to make that conversation less scary.
What is up, VetFolio Voice? In this episode, sponsored by Hills, I was thrilled to be joined once again by Dr. Ashley Bourgeois, the derm vet herself, to talk about allergies. Now, this is obviously a huge topic to tackle, but in this episode, we're talking about the importance of nutritional support as part of that multimodal plan that we need when we're managing pets with allergies. So, of course, this means we talk about food allergies and elimination diet trials, which can be very challenging but are hugely important diagnostic tools. I feel like we can't talk about that topic enough because it's just really challenging and there's a lot to it. But we also talked about nutritional support for animals with environmental allergies because even though it seems very unfair, animals with food allergies can also have environmental allergies and vice versa. And even allergic animals without a true food allergy can still benefit from nutritional support. I mean, let's be honest, in a severe allergy case, they can use all the support they can get. Lots of great information here. If you don't know her already, let me introduce her and we'll go ahead and get into it. Dr. Ashley Bourgeois is a board-certified veterinary dermatologist passionate about providing practical knowledge to general practitioners to help itchy pets. She completed her bachelor's degree at Iowa State University and graduated from the University of Missouri's College of Veterinary Medicine in 2010. She then completed a one-year small animal internship at Purdue University, and upon finishing her internship, accepted a residency position with Animal Dermatology Clinic's Tustin, California location in 2011. She became a diplomate of the American College of Veterinary Dermatology in 2014. Dr. Bourgeois is passionate about educating veterinarians in dermatology and work-life integration through her podcast, lecturing, and social media presence, which, as I mentioned before, if you don't already follow her, go check out her social media accounts under the Derm Vet. Tons of great information, great tips there for everybody in the profession. But for now, let's go ahead and talk about nutrition and allergies.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on VetFolio.com.
Well, thank you everybody for tuning into this episode where I'm joined by the one and only Dr. Ashley Bourgeois, the derm vet herself, and we're going to talk about derm, of course, dermatology. Before I go further, did I say your name correctly?
You did, and I have a sigh of relief when you said we're going to talk about derm. I'm like, I hope so, because if it's anything else, that's why I tell general practitioners I have such a huge amount of respect for them because you have to know everything to some degree. And if you get out of my derm ear bubble, I am helpless. So thank goodness.
You know, it takes all kinds, right? And I really do appreciate the shout out for GP. It has gotten as our knowledge base has like continued to just explode in veterinary medicine, it's gotten more and more challenging to, it's really hard to just be a jack of all trades anymore. And so we're so thankful for our specialists that we can call and say, okay, I did the things I know how to do. Now I need somebody else to jump in.
Yeah, collaborative effort for sure. I always tell my patients, especially when there's things that I need to talk to their vet about, or make sure we're on the same page for, I always tell them, like, we need a team effort on your pet, and that includes me, you as the owner, and then the general practitioner. So I love it.
Absolutely. Yeah, because there's so many things that go into it and so many different touch points that look different along the way. And we're going to talk about allergies. And Gosh, that's such a big category, and there's so much that goes into it. So, when we get these allergic dogs in general practice that we can kind of, okay, we've got these under control, then, we're patting ourselves on the back or high-fiving ourselves, whatever it may be. Rarely are allergies straightforward. There's so many different causes and they overlap. So, yeah, I'm definitely looking forward to jumping into this topic with you because there's so much to talk about and so much to uncover.
Yeah, I'm ready. Let's do it.
Let's do it. Let's do it. So, when we're thinking about, say, food allergic patients versus those with atopic dermatitis, what are some of the presenting signs that might cue us in to say, this one we should really be focused on food allergies, and then this one we should be more focused on environmental allergies or atopic dermatitis?
Yeah, it's a great question. And I think one that often gets overlooked. I will be honest, I am not a dermatologist who's like, everyone has to have a diet trial because it's just not realistic for some of our clients, right? Like whether they can do it, whether I'm really suspicious of it. But the flip side of that is you can't look at a dog and for sure clinically say your food or environmental, or maybe both, which we're going to talk a bit about, right? Because that exists without doing the steps. But there are certain cues I get that really make me think, whoa, we definitely need to do a diet trial. Like that is pertinent for you. I would say a big thing, obviously, is non-seasonal pruritus, especially if they've had non-seasonal pruritus from the get-go. Maybe there's slight fluctuations, but it never really stops with the season change. Then I absolutely would want to rule out a diet issue. Ears for sure. Now we see plenty of ear infections from atopic dermatitis. So just because a dog deals with ear issues doesn't mean it has to be food allergy. But when you get those cases where it seems like, and the ones, we all have them, like no matter what you do, you get them better with medication. As soon as you take away that eardrop, they're like instantly flaring. Like when we're just really struggling, and it's not just, oh, I got an ear infection in spring. I really want to rule out a food issue. And then any sort of gastrointestinal signs that are concurrently happening, right? So we don't just, as dermatologists, get the dogs who just have GI signs. Of course, internists deal with a lot of those cases, but we do get a lot of the cases where they have pruritus, they have otitis, but then when you really dig in, the owner mentions, well, they also have really soft stools. They seem really gassy, right? And that's really hard to tell some of our breeds like bulldogs. But if they have flatulence, if they have borborygmus, they have just a gurgly gut all the time. There's even a study done that also showed if you have more than 3 bowel movements a day on average. So sometimes you really have to dig into this stuff. It's not always just cow pie stools. It really can just be, they have 5 stools a day on, that's abnormal. So we really start to dig into some of those questions. Now, I also want to point out, because I hear this a lot, they don't have to have GI signs. So sometimes I'll see written in the record like GI is normal, not food allergy. We see plenty of cases who just have otitis, who just have pruritus, who just have recurrent infections. But those are probably the three main things that if that's in their history, I really, really want to talk to the owner about food workup.
Wow, I feel like especially the GI signs, that really gives us something to kind of dig into on the GP side before we refer and say, hey, are there GI signs? And like you said, sometimes it can be hard to tell. I'm curious in the subset that you see when you're suspicious of food allergies, do you find a fair number of those cases where, you know, GI is normal per the record, but you kind of have to dig in with the owners, and then it turns out that maybe we didn't get the whole story in GP, and there's more to it. There may be some GI signs going on that the owner didn't realize were significant.
Yeah, we definitely have that. And out of respect again for GPs, we are usually setting a bit more time to dig into this stuff, right?
Sure,
Like when you
sure.
guys are seeing like really quick appointments and, the next one's waiting or someone's crashing in the back or whatever it is that we are not dealing with, we can jump into that more. There's also, of course, a different subset of clients who are going to actually see a specialist who might dig into that stuff. But I do. I mean, I think a lot of times we assume that abnormal GI just means cow pie stools. Like that's what like that's all we ask. Like, are they runny stools? No, great. But it can be just mucousy stools. It can be mild blood in it. And again, it can be you're extra gassy, which with some of our breeds hard to tell, like you said. It can just be gurgly tummy. And I think the big one people don't realize is excessive bowel movements. Like the bowels are fine, but if you're having on average more than 3 a day, that is technically abnormal in the literature.
I could see that. I have a lab who, yeah, you'd think he could eat anything and be fine. He cannot. He's a very delicate guy. And yeah, and he was having lots of bowel movements, and it took a lot of trial and error to get him normalized. And you're right, like they weren't always abnormal. It was, but a lot of times they were. And but there were a lot of them, and it did take some dietary adjustments to really get control of that. So I think it gives us a good framework when we are asking those questions with these patients that we're trying to get control of their symptoms because I feel like with a lot of these food allergic patients, I mean, their symptoms can be pretty significant.
Oh yeah, and when you do have those, right, it's an easy thing. It's an easy thing when it's like, well, I constantly have runny stools, I constantly have diarrhea, and I have otitis. Like, of course, when you get all of those things, it's easy to say, oh, we really need to talk about food. But it's the subtle ones that can be really tough.
Sure.
And then the ones we're going to talk about that are combo allergies, again, can be really tough.
Right, right. Yeah, that's a good point of like some of these they can be really bad, but actually the more subtle ones might be harder to pin down what's wrong and what we're supposed to do. Kind of staying on the topic of food allergies here for a minute, our food intolerances. It's not always the easiest thing to get owners on board, especially if we don't have those GI signs to say, you know, we've got maybe we have the classic like we have itchy feet and these ear infections that we just can't get rid of, and to say we need to do a diet trial. And, then we're talking about changing a lot of things. And if this is a dog who gets a certain type of diet that the owner is really attached to, or gets a lot of treats or people food, convincing somebody that, hey, we really should think about doing an elimination trial can come with its own set of challenges. So I'm curious about the conversation that you have with pet owners and how you sort of address those concerns to help them get on board.
Absolutely. And Cassie, I'll be frank, I hate talking about food allergy too. Like, I
Makes me feel
know I
so
need to
I feel
do
so
it.
seen.
Yeah, I want to empathize because I think people are like, oh, like derm. I'm like, no, most of us don't because it is hard. It is hard to say, and there's lots of misinformation out there, right?
Mhm.
So I just had two people this week that came in with salivary tests that they could just order online off Amazon. And it was tough because I have to go through like, so sorry you spent that money, but we don't really find a lot of information that's credited. And we have many studies that show that food allergy testing, unfortunately, is not accurate. We want it to, but it just hasn't been shown to be accurate. But there are a few things I have just really kind of tried to tune in my years of doing dermatology to make that conversation less scary. I would say one, I really start with empathizing with owners. A lot of times these are dogs and clients I'm meeting for the first time. So I really want to empathize. And so when I start mentioning food, right, it's like I can just see because there are a lot of times they've tried to switch diets and they think they've given it their best chance. I tell them like food allergy is tough. You are going to get so much information onto what you feed your pet. And I instantly almost see like a shield go down because there's just like a recognition of, hey, listen, it is hard. And this is literally my job of what I do. And I'm just going to be frank with you that it is tough. There's so much information out there. We got palatability, right? We have to watch with pets. There's different thoughts of what they should feed their pets. So I just like to start with that. And I do find it helps a lot of my clients. But then when I really start talking about food allergy, I think there's a couple things that are really important. One, we need owners to know why we think we need to do a diet trial. Sometimes I think owners think we're just like going through the steps and we're just trying to like make all this money and switch, to what we want them to eat. But ultimately, I'll say like your dog has struggled with recurrent ear infections. That's something we can see with food allergy. There's a lot of pain right now we're going to have to go through with this diet trial. But my hope is if we can really do this right for 2 months, check off yes or no food matters, we're hoping to save a lot of heartache in the future, right? We're hoping to save these infections from coming back, the constant vet visits, medications like antimicrobials that they're not necessary. So it's like recognizing, like, yes, 8 weeks of a strict diet trial is tough, but in the short term, that pain is hopefully going to give us long-term gains in not having all these issues. The other thing I think really sticks with owners is we need to emphasize an elimination diet trial is a diagnostic test. I think, again, we kind of get stuck in this realm where owners were afraid they think we're just trying to change the food because, hooray, we want to. And it's easy for us to do that and send them on their way. But I really tell owners, like, this is a diagnostic test. This is the only thing that really can allow me to conclude your pet has a food allergy or not. And just like any other diagnostic test, if I submit a blood sample for something I'm looking for, right? If I do a cytology, you would never want to do those incorrectly. You would always want to do them right. And so that elimination diet trial is a diagnostic test. The hard part is I'm really relying on you as the owner to help me with that test. It's not something where I can just collect it today, submit, and we're done. So I do think that that really helps. I also give them an endpoint that if we get through, I'm an 8 weeker, I think most of us are. You get majority of pets by 8 weeks at the end of a diet trial if they're food allergic. At the end of those 8 weeks, I tell them, like, let's just get through these 8 weeks. And if they're food allergic, but you just want to introduce other things or you want to look for other diets, cool, we can. But I need to check that box of yes or no that your pet has a food allergy. I do think that that really helps just to say, like, this is a test, there is an endpoint. That doesn't mean they're allergic to every other food under the sun, right? We can do ingredient challenges, we can do all that stuff, but let's get through those 8 weeks first, and then we'll dive into that. And I feel like that's been really helpful when I have that talk.
Sure. Yeah, I think you made some really good points there. One, of saying, short-term pain for long-term gain. That makes a lot of sense because, if you do have a food allergic patient and we don't do this diet trial and we don't figure out if there's a food allergy, then we might just be continuing to treat these recurrent infections and worry about resistance. And, now the owner's having to make a lot of visits back and forth, and everyone is kind of frustrated because we're just not getting on top of this. And then also like to rule it out, to say, no, it's not a food allergy. And now we know to go a different route with our testing, our diagnostics, our treatment plans, and things like that. And we don't have this like lingering question in the back of our mind of, is this a food allergy? And if we just did a diet trial, would we fix the majority of this problem?
Yeah. Or if it's a combo dog,
Mhm.
are we going to miss something, right? With just assuming it's only environmental. So those ones
Right.
are the tricky ones.
Yeah, and so I'm glad you brought up the combo dog. I heard about this not too long ago, and when someone said it to me, like, well, they could just have both. And it makes so much sense, like logically. It's like, of course they could have both, but then when I heard it, I had this like visceral, like, but that's not fair. They
It's
can
not.
have both. And
Yeah.
so I'm glad you brought that up, because sometimes we'll do these diet trials and we'll get definitive improvement, but not necessarily resolution. And so I guess, how do you approach those cases? Do you ever say like, well, let's go a little bit longer, or are a lot of these, if at 8 weeks we have improvement but not resolution, then should we start thinking about these combo dogs?
Yeah, depending on the case and the client, I think all of those things, right? We really want this like strict algorithm that's like you do this, then you do this, then you do that. But our life is not like that, right? Our clients have lots of life variables. When I do certain diet trials, I ask them like, is this the right time to do a diet trial for you? I Yesterday in the clinic, I had an owner who is about to go on an international trip next week, and their son's watching the dog. And they're like, absolutely not. Like, there is no way our son is going to be strict with this diet when we're gone. I'm like, great. So they're going to call me when they get back and we're going to start it then. Right. So you really have to consider that. I think it's a disservice to our clients to not work with them to say, okay, is this the right time? Like, let's work with you so we gain that information. But the combo dogs, they can be tough. Ultimately, when we're doing it, I'm looking for lots of different things. So usually they're on some sort of antipyretic, right? If they're breaking out, like we're not going to have them be miserable for 8 weeks while we get through a diet trial, whether that's a JAK inhibitor or a monoclonal antibody or whatever controls them. Then our goal at the end is to try to withdraw that, right? We withdraw the medication. We've been on this diet for 8 weeks. We look to see what signs come back. Do they instantly start like licking their paws just as much as they did in the beginning when we started this process? Then maybe it's not a food allergy. But the misstep I see sometimes is we just get any sign back and then we panic and say it can't be food. So a classic one for me would be let's just say Frenchie because we see a lot of them.
Blue
So like
Frenchie.
we all the Frenchies. I
Yes.
have a pit bull. I see plenty of pit bulls in the
Sure.
clinic. And she's allergic. So let's say we do that diet trial. We put them on a JAK inhibitor. We start the diet trial. They're doing great. They have struggled with consistent otitis and pedal pruritus, so they're licking their paws. And then we get to the end of the diet trial, we stop the JAK inhibitor, and then they like within the first 2 days lick their paws a little bit, and then we're like, oh, can't be food. But maybe their ears are awesome. So that would be a really typical run. It's like, well, the ears are the best they've ever been, but they're kind of licking their paws when we stop the JAK inhibitor. Well, then you might really be both. The other thing you could do, right, is challenge. So we really like to withdraw antipyretics, give them a period of time, but then challenge. And then within that, say like week, if they start to notice signs really increase when they get their previous food back, and please, if you're going to challenge them for diagnosis, give them their previous food back. I find a lot of people will just like sprinkle chicken on top. You're just proving they're not chicken allergic. Remember, we're trying to answer yes or no with that initial challenge. So they really should get everything they've been getting before we did the diet trial. Because at that point, we're just answering yes or no. If they're yes, cool. You want to go down the rabbit hole of individual ingredients, we can do that. But we're just trying to answer yes or no. So those are the things I'd be really thoughtful of. Like, what have the problems been? Make a list for that patient when we do the diet trial. And then what's resolved. Of course, if they have GI signs and they get better within a couple of weeks with their GI, that is super helpful. And we do tend to see the GI signs get better before the derm signs. So if within a couple of weeks, like we went from 7 bowel movements a day to two, like that's a great sign for us. But if they don't have GI, I'd really urge veterinarians to look at the problems, look at the severity and what areas are affected when you go to the end of the diet trial in case they are a both dog.
That makes sense. It is so tempting because yeah, you want to like put them in one box and say, yes, if the paw licking comes back, oh, but it can't be that, it must be something else. But I think that's such a good point to pay attention to the subtleties that are affecting that patient. I feel a little bit silly asking this question because I feel like you're going to answer it. I'm going to be like, oh, yes, of course, that's the answer. So I think of a PVAS score for itching. Is there something similar for like paw licking and ears? And I'm asking because like you said, sometimes we'll get a little bit of that paw licking back, but it's been 8 weeks. So it's hard to say, like, is it as bad as it was before, or is it actually improved? Do we have any sort of more objective measure with ears and feet like we do with itching?
That's a great question. There have been like scores that have been attempted to be made with otitis. So there have been some that have been done like in the literature to look at things like severity of otitis, but on a clinical basis, we kind of lump everything into PVAS. So
Okay.
PVAS, if you look at the actual standardized scale, which you can find online, that's actually been validated through literature, it kind of includes all of that. So you bring up this is not a silly question, and this is a really important point when I'm asking owners what their dog or even let's just say cats like itch score is, so it's a validated score for dogs, we're also really mentioning itch is not just scratching. So it can be licking the paws, it can be head shaking, it could be scooting, it could be rubbing their back on the ground, it could be army crawling excessively. So you really do need to jump into what pruritus looks like because oftentimes, to your point, owners will just say like scratching. And then I'll ask about paw licking particularly, right? Because that's really common in dogs. And they're like, oh, yeah, they do that all the time, but they're just bored. It's not usually that they're just bored. They just don't really think about it being a sign of itch.
Sure, sure. And I can understand like the mental protective mechanism that happens. They're like, no, I can't add in another symptom.
Totally.
Just like the GI signs, I think you make a really good point of questions that we need to make sure that we're digging into. Certainly using these objective measures, but also helping owners understand what the answers to these questions mean in terms of, like you said, it's not just scratching, it's paw licking, and make sure that we are asking good questions while we're trying to get to the bottom of this. Because the other thing I think I love that you're illustrating here is how complex and how nuanced these cases can be and just how much variation there is patient to patient. So you really do have to dig in and again appreciate, of course, in dermatology there's the opportunity to dig in a little bit deeper, but it sounds like there are also some questions that we can sift through in general practice before that referral step. One of the other I guess kind of shifting into therapeutics here, but sticking with the complexity and the nuance of managing these cases. One of the other things I've heard you talk about is skin barrier. And I've said it on the podcast before, like I have keratosis. I'm very familiar with the importance of maintaining a healthy skin barrier because it's not fun to have like, dry, itchy skin. So I'm wondering if you can talk about the importance of maintaining the skin barrier and how you incorporate that into the management plan for these patients, whether it's during a food trial when we have them on a JAK inhibitor or something, or, we have our answers and then we need this long-term treatment plan.
Yeah, skin barrier is huge, right? And I do think it's been great in the last maybe 5, 10 years that there's been more focus on it. Like that's you hear us always throw around the term multimodal approach, and skin barrier is part of it. Like our pharmaceuticals are awesome. We need them. Listen, I lived in the world pre-JAK inhibitor, so I
Oh
lived in the world
gosh.
that we had steroid cyclosporin the end as far as more abrupt management for this pruritus. So it's been awesome to see all these JAK inhibitors coming out. And now we're going to have, numerous monoclonal antibodies for dogs. Hopefully things will come for cats. We all want it. But ultimately, it is really wonderful. But the flip side of that is it's not just a pruritic disease, it's a skin barrier disease. So it's very similar to atopic eczema in people, right? Or I will tell owners, like my family's from the north, like you walk outside and it's negative 30 degrees Fahrenheit. You're outside for like 2 minutes, right? And your knuckles start cracking and they're dry. Guess what happens? You start getting really itchy to them, right? You really start bugging them. It's kind of the same concept. So I think skin barrier is huge. There's a lot of research in our field looking into skin barrier, and microbiome is another huge thing, right? But it's all these organisms that live on your skin. So by restoring skin barrier, hopefully we make those organisms that are good organisms happy. But there's so many ways to restore skin barrier. Of course, we love topicals, right? We're dermatologists. It's the skin. You get to touch it. And we could talk endlessly about how topicals can be really, really helpful. And I really want to urge veterinarians or others in the vet field or listening technicians, CSRs. I also really want to urge the thought of like maintenance skin barrier. I think we have a tendency to just attack them with topicals when they're breaking out. But there is a lot of value to maintenance, to bathing once weekly with a maintenance shampoo, right? To restore the skin. Plus, you kind of force owners to look at the skin, right? And especially some of these breeds, it can be really hard for owners to pick up all these little subtleties that their pet could be flaring. But topicals are awesome. Not everyone could do all the topicals we want all the time. So then we need to look into alternatives, and one of those is nutrition. So oftentimes we just think of nutrition for food allergy, but there are great diets that exist that actually also help with skin barrier for atopic dermatitis. And one of those diets that actually helps in both realms would be something like Hill's Derm Complete, where you have the novel protein of it being egg based, which is a pretty minimal allergen in our world. But then you also have the benefit of the complex within that diet that supports skin barrier, which could also help with atopic dermatitis. So the nice thing about nutrition is that pets got to eat, right? The dog's got to eat. So you are able to allow them to feed the skin to restore that skin barrier in a way that's not as daunting for them. So whenever we talk about skin barrier, I always think it's really important to see what's possible for the owner. What are we trying to accomplish with that pet? And then open up the door of how we can restore skin barrier, because there's multiple ways that we can do that. By improving skin barrier, we're hoping that these allergens penetrate less, right? If you've got cracks and crevices in your skin that shouldn't be there, ragweed and dust mite and all these danders, they get in easier. Well, then if you're an allergic dog, it catapults your immune system to cause these pruritic cytokines. So there's a really nice marriage between protecting the outside barrier but also reducing the reaction they're having on the inside.
Absolutely. That makes so much sense. Can we dive in a little bit deeper with nutrition and skin barrier? Because I love that you brought up microbiome, because this is, I think, an area where we've kind of started to scratch the surface, and that we'll see a lot more information. This is just my own personal opinion, coming down the pipeline in years to
Oh, it's
come.
coming.
Oh, I'm so
We were just at
excited.
our annual derm meeting and there was like a whole section about microbiome.
Ah,
Like we're going to get so much information on it, and we should. It's really
yeah.
important.
And I mean, just the idea, anytime we talk microbiome, I get excited because I'm like, new therapeutic endpoints. Because, when we run out of options, I mean, that's just like the most defeated feeling when you're like, there's just nothing else I can do. I'm kind of stuck here. So when we're talking about a food like Germ Complete, Certainly the egg protein. So, like you said, fairly innocuous when it comes to derm. Are there other parts of that food that are playing a role in maintaining skin barrier, like you mentioned, microbiome, and aside from just the protein source?
Yeah, absolutely. So I have a histidine complex that actually helps to reduce histamine reactions. So that's kind of the nice thing about it. That especially when you're talking about dogs that maybe they're not going to work up both. That's what I always mention too. I think it's a great general practitioner diet. I mean, we also use it, but I think when you have those owners that are like, I'm not going to do a huge workup on my pet, right? Like, I just kind of want to manage the best we can, but I'm not going to go get my pet allergy tested. We have to think of spectrum of care, right? Like, not everyone's going to rush to us. So I think it's really nice that you can say, well, we potentially have a diet that could help both. Like, whether they're food allergic or helping the skin barrier with atopic dermatitis. And the other nice thing is that there is a puppy formulation. So if you do get these dogs that need something labeled for growth, then you have something like Derm Complete that's actually going to recognize like this is safe for you to be on as a growing dog, and then we can transition you if it's effective to a diet that's actually made for adult dogs. So there is a lot of benefit to that. But yes, beyond just the egg, like just egg being novel, there are actual studies that they have done, which anytime a diet comes out, right, I'm like, show me the studies because
Hmm.
we get inundated with supplements and diets that do these magical things. But unless there's actually papers showing it's true, we don't really know. But there are studies showing that Derm Complete can restore, their skin pretty quickly, like visible skin healing within a few weeks. And then also our hope is to reduce long-term medications because we're restoring that skin barrier from the inside out by nutrition actually helping the outside.
I love it. I love it. So more than just the novel protein, and like you said, it's being able to start them fairly young because it wouldn't if we're dealing with a food allergy, like if we had a really young puppy who is itchy, would that put food allergy higher on our list just because
If
less
they start their
exposure?
symptoms at under a year of age, I am always recommending that we do a diet trial. We do tend to see like dogs start really young, or sometimes the flip is they develop allergies at a later age and then they're food allergic, or, there's always we have now the ones that do anything in between. But
Right.
any dog where they can say like otitis, pruritus, infections, and we know it's allergic, right? We've controlled ectoparasites, all those other things. Like it started when they were under a year of age. I definitely suggest doing a diet trial. Absolutely.
Okay, I thought that was somewhere in the back of my mind. I'm glad that that was a real thing. I have those moments where I'm like, did I make this up? I'm glad
Oh,
I
me
didn't
too.
make that one up. Oh,
Like there was a study, they're like, oh, that's not actually a study. I'm like, dang it.
yeah, I could have sworn it was. It would have been so
Yeah.
nice if that was true. So on the flip side, what about our older patients when we're talking about food allergies, dietary sensitivities, but they have comorbidities, and so
Yeah.
maybe doing a diet trial isn't, it makes it, I guess it adds this extra layer of challenge.
It definitely adds an extra layer of challenge, and we absolutely have that happen, right? We are in a chronic specialty. So I have patients, I have practiced long enough. I've been in my this area for 10 years. I have had patients I have literally seen from puppy to, we are dealing with comorbidities as they get older. In nutrition have so many benefits in many diseases. And my tell owners, like the tough part is like you develop another disease, we're managing you with something like it doesn't make the other disease go away. You develop renal disease when you're older, right? Like allergies are still there, and those can be really tricky situations. Where we're really fortunate is that we are seeing more and more diets that are coming out that are addressing comorbidities. We know allergies, right, are one of the most common things, especially atopic dermatitis. It's one of the most common things that GPs manage. I mean, year after year, insurance claims show that atopic dermatitis is one of the main things that gets submitted, right? And otitis being another thing that gets submitted. So we know you all are seeing so much dermatology, but you also see them for a long time too. So what we're really lucky is that we are having amazing nutrition come out that recognizes that, right? So these young diets, it's great that we have diets labeled for growth, that if we do get those dogs developing allergies at a young age, we don't have to wait to actually help them with nutrition. But on the flip side of that, we have diets that also recognize things that pop up as patients get older. So for dogs, there's actually going to be Derm Complete with KD that comes out. So you have an allergic dog who also has renal disease. You are able to recognize both of those nutritional needs through a singular diet. So I think that's really helpful. Even I know we're focusing on dogs, but for cats, there's going to be, ZD, KD, like all these options where we potentially, and I'm glad I'm not a nutritionist, they're so smart to like figure out what they need in this realm. So I love using companies I trust that that is their expertise, but they're hearing us. They're hearing us that we do have these cases that are really, really tough. And not everyone's going to home cook a special home cook for their diet for their pet. So the fact that we essentially have a line like Derm Complete, I mean, you can start them as a puppy, you can switch them to adult, and if they happen to unfortunately develop renal disease as a senior patient, you can recognize that too. So I think that's great that we are seeing more and more of these diets come out.
Sure. The conversation for so long has been we have to pick what the most distressing problem is. What is causing that patient the most harm at that moment and address that more aggressively, sometimes at the expense of other conditions because we just don't have a choice. And so to not have to make that assessment, to not have to make that choice and be able to say, it's okay, we can keep addressing this chronic problem, for example, here and also address this new comorbidity that has presented without having to, sort of sacrifice one to treat the other is it's such a relief and to yeah, just one less decision we have to make without, and kind of question ourselves and go, did I, am I making the right call here?
Yeah, I mean, even like the low fat CD that's recently come out, right? That's high, like
Hmm.
soy, but also has low fat. I know a lot of my friends who we co-manage these cases with things like food allergy and GI disease, where they're like, they really need like lower fat content. It's just nice because you don't realize comorbidities are a problem until you run into cases that you're like, darn it, like I've managed you successfully for your food allergies so long, but now someone's telling me we need to switch what's been working. So we're really fortunate that they've recognized that and come out with them.
Yeah, yeah, absolutely. Gosh, because yeah, GI and skin, I would not want to decide between
Oh
those if I
man.
could,
And
if I didn't
I
have
was
to.
like, I mean, itch I can deal with, but when it's like getting calls about diarrhea all over the house, I'm like, thank you, internist. You were wonderful.
Yes, yeah. Oh gosh, yeah. Those two things. We have unhappy owners either way. If their dog is
Yeah.
super, super itchy or having diarrhea all over the house.
Yes.
Oh, well, and talking about this, like you said, the food companies are hearing us and they're creating these combination diets that are so, so helpful. We touched a little bit about microbiome and saying there's some things coming down the line there. I mean, just just this conversation in and of itself. I also remember pre-JAK inhibitor dermatology practice and I'm in general practice. I wasn't doing dermatology at that time. I can't even imagine some of the challenges that are now addressed by some of our newer drugs. And it seems like this area of research is going to continue to expand for good reason. We have a lot of patients affected by this. Like I said, through the insurance claims, we know that this is super common. So I guess I'm curious on your perspective of how our knowledge and treatment of allergies, food allergies, and atopic dermatitis has evolved over the years up until now, and what you foresee for that for the future.
Yeah, I mean, we have definitely learned, right, even since I went to school, about the importance of this being a cytokine-driven disease when you actually look internally, whereas historically, maybe we would think it was more histamine-driven and we would throw a lot of antihistamines at them. I think there is some support that can come from that, right? Like there is some recognition of an IgE and histamine, but we know for that direct pruritus, when you're talking about that inside portion, right? Not so much like the skin healing that we use with some of these diets, but the inside portion that we are seeing these Th2 cytokines. And that's why a lot of our new medications have been so revolutionary. But going back to what we talked about, I think when we look through the future, right, we're going to continue to get more and more things. And that's awesome. You just got to learn how you're going to weave those into your clinical practice. But I think that the focus we are seeing is beyond the amazing medications that we're getting to help stop itch abruptly, is that we are in it for the long game with these allergic patients. So, how do we focus on the things that are not just pruritus? How do we focus on the things that are skin barrier? And that's why I always am pushing veterinarians to think of skin barrier beyond just reactive to infection. Like we want to think about maintenance, whatever that means for them. And we've already talked about it, but I just totally agree with you. Microbiome, like it's huge. We're seeing so much research towards it. I think that there's something to be said about the gut microbiome and the skin microbiome, the brain microbiome, like all these things. So I know there's studies being done to look at, well, if you have do atopic dermatitis dogs have an abnormal gut microbiome? Like, could we restore that and help? There's studies looking at like young puppies getting probiotics. And then are they less likely to develop allergies in the future? We have some studies that are helpful and suggestive of that, but I really think we have to consider this disease, atopic dermatitis, as a syndrome, not just a singular disease. So that's where we're really leaning on the things like nutrition, like restoration of, the gut microbiome, which we're seeing some of these diets, right? Like GI biome that really, really focus on gut microbiome. I know that I am not an internist and I do not see diarrhea unless it's with food allergy, but I know there's a huge shift away from like, metronidazole and really looking at these other ways to restore some of these acute cases. So I think in general, veterinary medicine is very exciting right now because we have new medications that have come out, but we're just seeing more and more literature and research and products that are looking at other avenues of managing this disease. And I can't wait to see what comes out in the next couple of years.
I couldn't agree more. It's been so exciting just, over the last, say, 10 years or so, the options we have available that we never knew that we would ever have available. And it's so nice to be able to offer owners those options. And I think this is another example of the research being responsive to some of the demand. We pet owners are wanting that, they're wanting, can we feed a food that will help and lean more towards things like food and away from medications where it makes sense. And in some cases, we see pet owners kind of go off and do that on their own, sometimes to the detriment of their animal. And so being able to provide these options that sort of answer those questions and meet those needs where we can in a way that's safe and effective for the animals is, I'm so excited. I can't wait to see where it all goes.
Well, yeah, and feeding off what you're saying too, many owners are very aware of microbiome. Like if I start talking to owners about it, like, oh, microbiome, they're just like, oh, yes, exciting. Like, tell me, because they think of what they hear about their own. So owners are looking for it. Owners really are. Like they are looking for, like, yes, they understand we need to start like this medication and make them feel better. But what about, especially because we do have to use, unfortunately, in some of these cases, a good amount of antimicrobials. So I have many owners proactively asking me, like, what about their good bacteria? What about the microbiome? So when you start opening that door and saying, like, hey, I hear you, I'm excited about it, we're getting more and more things. Let's talk about the diets we have that actually do address that. Owners really appreciate that and they're looking for it.
Absolutely. Yeah, that's been my experience too, is it's a conversation that people are wanting to have, much less than, what we had several years ago of, oh, the antibiotics just work, just refill my antibiotics. We're becoming more aware of that, not just in veterinary medicine, but just in general. And so getting more acceptance for some of these treatment plans.
Yeah.
Well, Ashley, it's always so much fun to talk to you. This is certainly no exception. I always learn a lot, and again, no exception. It's always just so informative and helpful. So thank you for joining me this afternoon. Is there anything we missed? Anything you want to leave listeners with?
Yeah, and thank you, Cassie. Pleasure always. Whenever they're like, do a podcast with Cassie, I'm like, easy, yes, like so
Yay,
much
same.
fun. I really just summarizing, I would say we need to be open to clients and we really need to realize that this is a tough disease that we need to hit from different angles. But I want to backpedal on that. You also need to make the plan realistic for your owner. So oftentimes we are as dermatologists asking them to do a lot, but I really like to check in with owners and basically say like, is this a realistic plan for you? And you can't assume because some owners, man, it's like they want 20 things, right? They're like, this is my baby. I have an Excel sheet. Like, what else can I do? Like they're ready. But for a lot of us, and as a mom of two young kids with an allergic dog, like we do have to pick and choose sometimes. So that's why I think you need to be familiar with things like if we want to help the skin barrier and topicals are just not in their wheelhouse right now, like could you use nutrition? I really like to look at every individual allergic case as a puzzle and I have to be able to flex with them and put together the puzzle that makes sense for them. I am not a clinician that just says like these are the 5 things I use and that's what we do. Like I'm nerdy and this is why I'm a dermatologist, but I kind of find it exciting just to ask like, could you do this? Okay, you can't do that. Could we do this? Like, let's make sure we work together to get a plan set for you. So I really want to push people in the veterinary field, like be comfortable with the things you really enjoy, but also realize we have lots of options out there and every client might be looking for something a little different.
I love that summary. And if solving the puzzle makes you nerdy, then I'm right there with you because that's one of my favorite parts
Perfect.
is figuring out, what's going to work for this individual patient. And then I love that it's different for everybody and you have to kind of like you said, flex with the owner and figure out what's going to work. Will that patient take medication or can they come in and get injections, whatever it may be. So yeah, I couldn't agree more. Thank you again, Ashley. This has been so much fun.
Thank you.
Well, I want to say a huge thank you to Hills for making this episode possible. Ashley, thank you again for joining me. I always have such a good time when we get the chance to talk. I learn so much. I mean, just dermatology in general is such an important topic that we all, I think, have cases we struggle with. And there's so much to sort of wrap our brains around when it comes to dermatology. And so I'm just so thankful every time we get to have a conversation and I can pick your brain on this topic. Big thank you to everyone out there who tuned in. I really hope you enjoyed this episode. If you did, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. Of course, I want to hear your ideas for this episode. I want to hear ideas for what you'd like to hear from us in the future. So feel free to reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.